Chapter 14, Inclusive Aquatics. I can't fly, but I can swim, and that's the next best thing. The water is my sky. Aquatics. Aquatic environments offer benefits: fun and enjoyment, accommodation, creativity, cross-training. Movement in water liberates the body, enhances function and well-being, and allows playfulness and exhilaration that are often exclusive on land. The benefits of participation. Equalizing environment of water can be partial or full immersion. This main benefit creates access to countless other benefits that come from inclusive aquatics. Other factors facilitating inclusion include preparation of coaches and instructors, ease of entering the facility and pool temperature, array and type of exercise and swimming equipment, inform and educate all parties. The physical benefits. Hydrodynamic properties enhance these factors: safety and function of participant, enjoyment and comfort, relaxation and fitness. Immersion transfers heat to the body. With 92 to 96 degrees, relieves pain and increases range of motion. 83 to 88 helps arthritis and fibromyalgia relief. If it's 83 to 86 degrees, it prevents arrhythmias. Cognitive and intellectual benefits. Motivates via a stimulating environment. Studies suggest the following: improved cognition in people with fibromyalgia, reduced depression and anxiety, improved swimming skills in kids with autism, and teaching multiple steps or tasks to kids with autism. The psychosocial benefits includes water creates an opportunity to socialize. There's easier movement in water, creates a sense of independence and control, creates opportunities for success, improves body image and self-esteem, and enhances a sense of meaning and purpose. Apprehensions. Concern for wearing a swimsuit in public. Addresses this concern, acknowledge it with respect, and ask questions to explore solutions. Common solutions might be talking it through and realizing similar discomforts among other swimmers in the group are often enough. Shorts and a top work for some. Swimwear probably should be flexible but safe, and do gender-specific activities. Safe, successful, and rewarding programs. Instructor training and credentialing, coaching, communication skills, collaboration, integration, and promotion. Instructor training and credentialing. The key factor to inclusion is the instructor. Knowledge, her beliefs, or his beliefs, or his or her attitudes. Additional considerations: availability of the right kinds of equipment, high quality, hands-on training is important. Training instructors. In the study of physical educators, hands-on training ranks as the most valuable knowledge source for teaching students with disabilities and combining people with diverse needs and backgrounds into group programs. Training sources and resources include the following: AAPAR, YMCA, Aquatic Exercise Association, Arthritis Foundation, and Aquatic Therapy and Rehab Institute. And I know you can get certified through the Aquatic Exercise Association to actually teach group fitness in the water, aqua aerobics. I think they have special population certifications and so on. Coaching communication skills. Listening is the most important skill. Start with a welcoming, accepting attitude. Ask open-ended questions. Use the answers to form your next question. Go over what you expect from each other. Together as equals, share the planning. Answer questions with patience. Communicate at eye level. Make contact when appropriate. Prepare, know procedures and equipment. Build trust and rapport through respect, and be prepared for communication challenges. Critical areas of support can include resource support, technical support, and moral support. Suggestions include identity and inventory stakeholders and champions, identifying your community service resources, collaboration with educational institutions, establish mentor programs, and seek out experts. Effects of legislation. Americans with Disabilities Act requires reasonable accommodation. Policies, facilities, and programs must be accessible. Reasonable accommodations must not place undue hardship on organization. Pools must be readily accessible, and accommodations must be readily achievable. Exceptions to reasonable accommodations. Person does not meet the criteria of a qualified individual with a disability. Person does not meet the qualifications to participate in the activity. Person creates reasonable probability of substantial risk to self or others, and modifications significantly alter the nature of the program. Pool access, key resources, accessible swimming pools and spas, a summary of accessibility guidelines for recreation facilities. Examples of entry guidelines: pools with less than 300 linear feet of pool wall, pools with more than 200 linear feet of pool wall, spas, wave action pools or leisure rivers, and wading pools. Transfer considerations. Safety is always first. Use proper equipment, ensure proper body mechanics, assess person and circumstances every time, always give a heads up. Afterward, ensure comfort and correct position. Pool, entry, and pool lifts, sloped entries, gradually sloping stairs, portable and permanent lift devices, portable stairs, or aquatic platforms. Surrounding environment, accessible routes on deck space, clear deck space next to lifts, clear deck space near transfer walls, go beyond the legal requirement, and proactively examine the environment. Temperature and humidity. Temps greater than 88 degrees, not appropriate for cardiovascular or aerobic activity. Non-aerobic range of motion activities can be done in water 94 to 104. People with MS exercise in cool water, 80 to 85% or 80 degrees, 5 degrees. Warm water exacerbates symptoms. And 80% or 80 degrees, for pregnant women to keep core temperature at a safe, comfortable range. Those are all really important if you're working with special populations. The temperature of the water is really something you need to take note of if you're going to work with in the aquatic areas or arena. Risk management accommodation, locker rooms and restrooms, the aquatic environment, special accommodations. Hydrodynamics, buoyancy, movement of force, viscosity, and hydrostatic pressure. Eddy drag. For example, a nearby conductive surface will exert a drag force on a moving magnet that opposes its motion due to eddy currents induced in the surface by the moving magnetic field. Positioning, stabilization, and form. Buoyancy can alter posture. Risk groups for compromised posture, people with weak core muscle strength, a typical body posture, or high percentage or a typical distribution of body fat. Increases a lordotic curve, that is the arch and low back. It may teach brace neutral position to limit risk of back and neck complications. Brace neutral position. Contract abs from pelvis to breastbone. Avoid tipping the pelvis under. Keep shoulders back and down to the open chest. Keep the head level. Breathe deeply while stabilizing. Practice moving around the pool while maintaining the brace neutral position. See figure 14.3. And here it is. Using hydrodynamics, both safely and effectively increasing resistance, increase speed, use water resistance equipment. Use correct amount of resistance, use the FIT acronym, frequency, intensity, type, and time, and adjust only one element at a time. Aquatic workout structure, thermal warm-up stretch, aerobic exercise, muscle and strength endurance, and then their final cool down and stretch. Contraindicating conditions would be a fever, urinary infection, open wound, or infectious disease that is transmissible through water or with casual contact. Safety and injury prevention. Protect the body from injury. Use the brace neutral position to stabilize posture. Return to this position frequently. Breathe properly. Avoid hyperextension of joints. Maintain balance. Bring heels all the way down to the pool floor. Access breathing to monitor intensity. Use the talk test. Keep muscles warm during stretching. Avoid bouncing stretches during warm-up and cool-down. Increase challenges gradually. Exercise muscles evenly. Protect the wrist and joint. Avoid eating 90 minutes before activity. Prevent chlorine irritation by showering with soap before entering the pool, and drink water. Aquatic principles are used as therapy. Balance, strength and core stability, flexibility, coordination and movement skills, and cardiopulmonary function. Watsu is an example. Minimization of pressure on joints is the key advantage of aquatic rehabilitation. Summary. Aquatic environment is dynamically empowering. Aquatic staff can use this environment to create a culture of acceptance. Knowledge, skills, and attitudes related to aquatics and inclusion are key to success. Benefits to all mirror the definition of health and well-being.